esteemed guests and my all beloved friends, happy Vaishakha Purnima Day. And on this very auspicious occasion, Buddhism and Health Conference is organized by my very best friend Mangesh Devale. And such conferences are very needed because Buddhism has utility in all the aspects of life, and health is a one important aspect. Because health is the highest gain, contentment is greater wealth, trust is the best relative, and Nibbana is the highest happiness as told by Buddha. So health is the highest gain because without health, nothing is possible. Without health, we cannot attain peace, we cannot attain even Nibbana, we cannot attain any activity, any business related activities, and nothing is possible without a perfect health. So, taking this topic forward, I introduce first a topic because public health might be a new subject from some of the people from you, among you. And to introduce this public health in the Buddhism domain, let me explain some of the terms. But first, Buddhism in a very short way, because a lot of people, a lot of esteemed guests, our previous panel esteemed guest has already talked about this. And Buddhism in nutshell, it is sabba papasya karanam kusalesa upasampada sachitta pariyodapanam etang buddhana sasanam. To avoid impure deeds, to attain skillful deeds, to purify the mind is the Buddha's teaching. It's very simple. Everybody has heard it. And the same question was put forward by a king in Sri Lanka to Ashwagosha. This is a very simple one. And you have told the gist of the Buddhism, but Ashwagosha tells him that even though it's very simple, but it's very difficult for the person even of the age of 80 years, because it's very simple to tell, but it's very difficult to follow. So Buddhism is very simple to tell, but it's also very difficult to follow. And we as a human beings, when we have strived for the highest gift of Nibbana, highest achievement of Nibbana, then these efforts are very worth. So sabba papasya karam, that means to avoid the impure deeds. What are those impure deeds? That Panchashila that we recite every day, that there it is. And to attain the skillful deeds, skillful means what? Skillful means devoid of greed, hatred and delusion. Because our human mind, our human nature, our human life works on these three aspects. Unless we get overcome by this greed, hatred and delusion, our whole life is revolved around these three aspects. Greed, hatred and delusion, these are the three fetters. And to purify the mind is the Buddha's teaching. The mind, purification of the mind is very essential, because the Buddha's whole philosophy is revolved around the mind. In Pali, there is a Yamakvagga, Dhammapada, there is a Yamakvagga. It says, Mano Pubbangama Dhamma, Mano Settha, Manomaya, Manasacha Padutthena Bhasatova Karotova, Tatonam Dukkha Mandveti Chakkangva Vahatopadam. That means mind is the forerunner of all the things. If we have unskillful mind, if our mind is not happy, then whatever we follow is only the suffering. Just like the bullock cart is to be pulled away by the bulls. So in the same way, if we do the unskillful deeds, then suffering follows. But in the next verse, Buddha says opposite of this, Mano Pubbangama Dhamma Mano Settha Manomaya Manasacha Pasanniti Bhasatova Karitova Tatonam Sukha Mandveti Sakho Mandveti Chaya Nam Anapayeni. That means whenever we do the actions with skillful mind, skilled mind, that means devoid of greed, hatred and delusion, then the happiness follows, just like our shadow. Whenever we go, we don't have to pull our shadow, it comes automatically to us. So whenever we follow Buddha's path, whenever we do the skillful deeds, then the not suffering, but the happiness follows. So in short, this is what Buddha has told. So let's move to public health. First to health. So what is health? So as per WHO, health is a state of complete physical, mental and social well-being, and not merely an absence of disease or infirmity. So health this is a very broad definition of health. Just having absence of any disease I don't have any hypertension or diabetes or something else, some other disease, so I am healthy. That doesn't fit into that definition of health. What is it again? Again, then we have a complete mental and social well-being. So unless we have the mind, which is the happy one, and the social well-being, that means we are very much socially oriented, we have a no communication problem with anybody else, then we are happy, then we are healthy. Otherwise, we are not healthy in this definition of health. So this is very broad definition, and let's come to public health. So what is public health? It's very very detailed definition. We will not go into the detailed definition. You can read over the screen, from the screen. But simply it says science and art of preventing disease, prolonging life, and promoting health. That means it's prevention and promotion of health, prevention of disease and promotion of health is a public health. And to attain these goals, then various organized efforts are taken. For example, in epidemic, the whole health team is there to take care. For example, in pandemics like COVID, the whole medical fraternity was there to take care of us. Everything was organized, but there were lack of resources, but everything was tried to be organized. So that's one aspect of public health. And in the prevention aspect, there are different categories of prevention. For example, primordial prevention, primary prevention, secondary prevention, and tertiary prevention. The primordial prevention is very basic one, like health education. The primary prevention you can compare with the vaccination. Taking vaccination is a primary kind of prevention. The secondary prevention is like, taking care of your risk factors. Dr. Shankar Khobragade has told about this in the morning, that we should be very moderate in our eating. The lifestyle should be like that it should prevent the disease and it should promote our life. So that kind of is a secondary prevention. And the tertiary prevention, whenever any disease comes, for example, when we are infected by some disease, for example, when we are suffering from diabetes, then taking care that the sugar does not exceed the threshold. So that kind of is a tertiary prevention. And there is also a rehabilitation one, the next aspect of it. There is, if some person is handicapped, for example, in sickle cell anemia, then there are various measures to rehabilitate that person. So this is one aspect of prevention. Then the promotion of life. That means we take those measures that should promote the life. We should act in such a way that should promote the life and not, cut short it. So let's move forward further after this definition of public health, and let's come to some very short introduction again. This is a triad of cause of disease. This is a triad: host, environment, and agent. When we see the host host has various characteristics. What is the age, the sex, the race, the gender, the profile, previous disease, immune status, religion, customs, occupation, marital status, and family background. So whenever, for example, genetic diseases, for example, take the example of sickle cell anemia. Sickle cell anemia is a hereditary disease. In sickle cell anemia, the RBCs, the red blood cells, becomes sickle-celled. That means kind of a koita, you say. So it becomes a curve shape, and they are not able to absorb oxygen, and then the whole body has lack of oxygen. It gets stuck up in the arteries, and then it causes problems like pain, the sickle cell crisis we say in the medical terminology. So such is the host, then genetic, and then there is also a social system as well. For example, caste-based social exclusion is there. There are various diseases, various, we can say, discriminations. Because of that, the disease, increases. I have that research topic, caste-based social exclusion and health outcomes. And there is a discrimination even in the health systems, in the provision of the health services through the health system. For example, in the vaccination status, the vaccination of the scheduled caste and scheduled tribe is far below than the upper caste categories. So it's also kind of a discrimination due to that. The disease also is gotten by these people, the people who are coming from the lower caste. Then there is environment. The environment, temperature, for example, we suffer a high degree of temperature in Nagpur, then we get the sunstrokes. Some of the people get sunstrokes. We see the people who have only shades, the tin shades. There the temperature increases, they don't have cooler or ACs, the temperature increases, sunstroke is there, and then sometimes if they get sometimes if they are lucky, they get the proper treatment, otherwise they succumb to that heat stroke. The temperature, then the humidity, then the crowding, housing neighborhood, water, milk, food, radiation, pollution, noise. So all these environmental factors also cause the disease. Then there is agent. It's not difficult to understand. Agent is biological one, bacteria, viruses. There are chemical agents which cause the diseases. Cancers, for example, is caused by the benzenes. Then poison, alcohol, smoke. Physical, the trauma, radiation, and the nutritional aspect. For example, lack of it or excess of it. We just heard from Dr. Shankar Kobragades about the obesity. It's a new pandemic in the present era. So coming to Buddhism now, we have heard about this public health aspects, the cause of the disease, host, environment, and agent. So what is the cause of the disease when we look at Buddhism? So the Buddha has said there is a disease, there is a suffering, and the cause of it. And the cause of the suffering is tanha. Tanha means greed, hatred, and delusion. So it's simple. Greed means we want more and more of it. For example, the food, once we satiated, but still we have a palatable food after a dinner or eating anything. That's kind of a greed as well. Greed means whatever we cherish, we like that having more of it. That's greed. Hatred is we don't want anything. We have a dislike for that particular thing. Then we have a hatred towards it. That can be a thing, a material or a person. And delusions means that we are not able to see clearly through any phenomena. So that's a delusion. Due to that, the suffering is also caused. So this is an internal aspect of Buddhism. That means it's a mental one. So does Buddhism ignore the external cause of agent and environment? Because we have seen in the public health that there is a host, environment, and agent. This is a triad of cause of suffering, cause of disease. Yes, there is, because when we move forward, the cause of disease in Indian medicine, because Indian medicine is very much integrated with Buddhism. In Vinay Pitaka, there is a Bheshajya Skandha. And in Bheshajya Skandha, there are various kind of poultices are there. The description of it, how the poultice should be made whenever there has been any pain or inflammation, swelling. And there is also a different kind of porridges are there, means Yavagu we say in Ayurveda. So these three kinds of causes are there when we think about public health. What are these three causes? Pragyaparad, that means unskillful actions. Asatmya indriyartha sanyog, that means contact with inappropriate materials. And there is kal or parinam. So what is this prajnaparad? Prajnaparad means unskillful actions, means that we should not do in ideal circumstances. For example, whenever we are very much disturbed, then spreading that anger somewhere else. It's also kind of a prajnaparad in one way. Or also when we have satiated ourselves, but then again asking for more, even if satiated, so that is also prajnaparad. Asatmya indriyartha sanyog, that means contact with inappropriate materials. When we think, we realize that something is not appropriate for us. For example, intoxicants, for example, tobacco, smoking, it's inappropriate. But still, when somebody has it, then that get the disease, that person get the disease. Then there is kal or parinam, environment that we already described. Now let's come to the Buddhism and health aspect. How do we integrate both these aspects? The next slide is about knowing well the disease. The physicians knows the disease, and the patient also realizes that he has some disturbances in his body, and he goes to the doctor. The doctor sees that and examines him. Darshan, sparshan, prashna is there, by seeing, by asking, and by touching. So all by this physical examination, the physician comes to the conclusion that there is a disease. And then by examination and by the pathological test and also radiological test, he also comes to the conclusion that such is cause of the disease. And when the physician knows that such is the cause of the disease, then according to the disease, he prescribes the treatment. And after knowing well that after curing the disease, there will be no recurrence. This is also very important one, because if the cure of the disease is very temporary, not permanent one, then the suffering comes abound again and again in repetitive way. It comes and goes. So the recurrence should not be there. The physician also takes care of that. And it's also taking care by the physician also that the treatment is not unaffordable to the patient as well. Because if the treatment is unaffordable to the patient will not be able to buy the medicines, and it will be futile by the doctor to prescribe that particular treatment. So it's also, nowadays, it's very important that the physician knows that the medicine is completely cure for the patient and is also affordable one. So these are the four aspects, the four noble truths, and let's come to 5 minutes, okay, I will wind up, no problem. So preventing disease. Now let's come to the preventing disease aspect. Preventing disease, so there is a Panchashila. In Buddhism, there is a Panchashila, and it has a very, very beneficial effect on the health of the people. For example, Panatipata. Let's take it one by one, and I will only tell the benefits. Okay. Panatipata creates a positive atmosphere that contributes to physical and mental well-being. Panatipata, not hurting anyone, not harming anyone. If we do not harm anyone, then we have what we create a positive atmosphere, not a negative one. A person who is very much angry and tries to others or thinks of trying to hurt others, he is not peaceful for himself, and also he is a problem creator for others. So it's create a positive atmosphere if we follow the first Panchashila, Panatipata. Then Adinadana can help develop a sense of contentment and reduce stress and anxiety associated with greed and envy. The person, unless he is psychologically imbalanced, the Adindana person who does it, the person who is in want or is in greed, wanting is a different one, but if it's in greed, then he steals the materials from others. But the person, even now you say stealing is also in another different forms. The corruption is there is also kind of a stealing if the corruption is there. So if it's not there, if the Adinadana is there, if he is not stealing anything, stealing means, Adinadana means taking the material from the person without his or her permission. So that is Adinadana. So if Adinadana is there, then it can develop a sense of contentment and reduce stress and anxiety associated with greed and envy. Because for example, I go to somewhere and I forget this mobile, and if it's stolen, if it is taken away by somebody else, and he's not taking care to return it, then I will feel stress and anxiety. Oh, my mobile was there, and I had a lot of good data there, and then I had a financial transaction I used to do with that mobile, and there are all the contacts one. So a lot of data contacts was there, so I will be very in stressful condition. So Adinadana, is very important aspect of the Panchashil, which also promotes health. Then Kame Sumichachara. Kame Sumichachara, that means a sexual misconduct. If the sexual misconduct is not there, it promotes emotional stability, because the trust it builds between the partners. It prevents the emotional distress and reduce the risk of sexually transmitted disease. STDs are reduced due to this Kame Sumichachara. So it's one aspect of the public health. Then Musavada, contribute to harmonious and supportive social environment, which is essential for mental and emotional well-being. So Musavada. So I lived in a place of Madhya Pradesh in particular. I take the name of the district, and many people were telling that don't trust the people because the people they lie to each other. So I was very much distrustful. Whom to trust, what to tell, and how much to take from there. How much to trust on their words. So if such a kind of atmosphere is there, then it's very difficult to live. And there will be also anxiety and stress among us. See, what should I tell, and whom should I trust, and so every aspect of the life will be very much disturbed if Musavada is there. Then Sura Mere Majja. If Sura Mere Majja means not taking the intoxicant like drinking the wine or other intoxicating materials. If it's not there, then it maintains physical health, mental clarity, emotional balance, reducing the risk of addiction and related health issues. Because many health-related issues comes due to this problem of Sura Mere Majja. Baba Sahib Ambedkar has, in Buddha in his Dhamma, has told about the 6 perils of, having intoxicating drinks. Means the person becomes poorer, he does not have the mental stability, and he is not trusted. So these 6 of these perils that he has described in book 5th, part 5th and chapter 2. So you can go through it. It's very given there, and because also our society is also very much things to be addicted to such intoxicating things like drinking liquor. So such alcoholism should be avoided at any cost. Then there is a eightfold path. So eightfold path is also very much related. It has a beneficial effect on the health of the people. If we follow Samyak Ditthi means what? It's a right view. It's perfect view. And what is the perfect view? That means if we study Buddhism and if we see the wisdom, that if we gain the wisdom means what? Anitya Anatmata and Dukkha. Anitya Anatma and Dukkha. That means the situation changes, the people changes, means everything is going to change, is bound to change. There is no self, whatever I am, because there are so many people that we are very much attached to the positions, the power, and then we have some attachment to this, cling to I. So I is not fixed one, it's impermanent. If we, see this and realize this, then we practice Samyak Ditthi, and practicing Samyak Ditthi, we have a clarity of mind. And when we have a clarity of mind, we get the wisdom, then whatever actions we perform, that have the beneficial effect on health. Then Samyak Sankalpa, it supports ethical conduct and a positive mental state. Samyak Sankalpa means right determination. The determination should be right. That determination should not harm others. Even if it's very ambitious one, we are very ambitious, that's very good, but it should not harm others. So if it is that Samyak Sankalpa, then that promotes a positive mental state. Then Samyak Vacha. Samyak Vacha contributes to harmonious relationship and emotional well-being. Kabir has said about a lot of things about this Shabda. So it's a lot of gathas are there, but due to his dohas are there, but due to time constraint, I would not be able to go into that details. But Samyak Vacha, we must realize in our daily life that Vacha, these words are very important, but some words are very much harsh, then it will divide the people. And if this and some words are so that it has truthfulness, it has melodiousness, and it has set in the right tone and set with the good intention. It unites the people, and such unity or such vacha gives rise to physical and mental health. Okay. Then Samyak Ajivika contributes to well-being of oneself and others. So whatever our livelihood is there, then that livelihood should contribute to ours and other positive mental states, ours and others' health. For example, if you are involved in such professions like selling liquor, for example, selling weapons, so such kind of livelihoods are harmful to other people, and that should not be done. Whatever Samyak Ajivika, which is very helpful, beneficial to others, even if it's not beneficial to others, it should not harm others, that should be taken care. Then Samyak Vayam supports emotional balance and psychological well-being. Samyak Vayam means doing those things which are repetitively, which are beneficial to others, promoting those things which are already we have ingrained, the good qualities that we should develop. That qualities that we have not developed, that means that is not within ourselves, that we should try to bring upon ourselves. So that is definition of Samyak Vayam. The Samyak Sati enhances self-awareness and emotional regulation. Sati means mindfulness, and in health aspect, mindfulness is very important. Mindfulness means whatever we are doing, we should be very much engrossed on it. When we are listening, then we don't have any thoughts, we are just listening. Within listening, there is a listening. So without listening, no other activities are taken. That is a mindfulness. So whatever we are doing, we are completely engrossed with that particular actions, that is mindfulness. Samyak Samadhi leads to inner peace and psychological resilience. If we have a Samyak Samadhi means those skillful states, and we have a focused mind, and that mind leads to our inner peace. And whenever we have inner peace and psychological resilience, then we will not have disease, because inner peace will promote goodness, it will promote the good qualities, it will promote the good actions on our part. So let's come to next slide. It's mind-body wellness through meditation. There are a lot of benefits of this. There is stress reduction. There is a lot of research going on about mindful-based stress reductions. There are a lot of research articles over there. You can search on it. And it is proved beyond doubt that mindfulness-related practice also reduces stress. And once we reduce stress, then a lot of diseases, the physical diseases, gets reduced. Because many diseases, because our human is mind-body. It's a mind-body interactions. We are not separate. The mind is not separate from the body, and body is not separate from the mind. They are both dependent upon each other. Everybody knows that. Just 2 minutes. I will be finishing. 2 minutes. So, emotional regulation, stress reduction, and then emotional regulation. It has also a beneficial effect. Then there is an enhanced self-awareness. When we are aware of ourselves, then we are healthy. It improves the immune function, pain management, higher self-esteem, and enriched empathy. Because when we practice Buddhism, then we understand our body, we understand our mind, and whenever we understand ourselves, then there is self-awareness, and whenever there is awareness, we are very much lower to do the wrongful actions. So we very much avoid the wrongful actions. So it directly affects our health. So these are some of the, next slide please, These are the public health research on Buddhism and health, and there are different topics. For example, most of these are about the mental health. There are many of the research topics there. You can find it on the Google it. And lot of research has been taken on mindful-based stress reduction. It's about application of Buddhist principles into public health, integration into traditional medicine, and Buddhist-based practices and cultivation of positive mental faculties among students. Then pain-killing effect of 3 meditation types: breathing mindfulness, loving kindness meditation, and samatha meditation. So these meditative practices have effects on the painkiller aspect. They have also analgesic effects. There is also effect of mindfulness on practices on anxiety and stress, is very much emphasized. Then also there is also one important paper about irritable bowel syndrome and inflammatory bowel disease. Irritable bowel syndrome, the person who has this kind of disease, he has to go a lot of, he passes many times stools, and it's a mucoid stools, and there is abdominal discomfort, and whenever he takes food, he has problems, and then again he goes to toilet and passes the stools. So irritable bowel syndrome and inflammatory bowel disease, these both diseases are also psychosomatic, and because of the mindfulness, there is evidence on it. Because of the mindfulness practices and loving kindness, imaginary and meditation practices, breath awareness practices, the IBS and IBD can be controlled. Now last slide, this is about health indicators of India versus other Buddhist nations. You can see, next one, the next. You can see there is a dark red column is there, that is in infant mortality rate. The infant mortality rate means per 1,000 live births, how many children are dead? Per 1,000 live births, how many infants are dead? So that is infant mortality rate. So infant means the child who is within 1 year of age. You can see India has higher most infant mortality rates, 25.5. You see Sri Lanka 6.2, Japan 1.8, China 6.8, South Korea 2.6, and Thailand 6.5, and Taiwan 3.2. There is no comparison of India with other countries. India is far much higher in terms of infant mortality rate. We lose more children, more infants than other countries. Then The another one, the middle column, it's a slightly pink one, it's a maternal mortality rate. Maternal mortality means within per 1 lakh pregnancies, how many mothers we lose? How many mothers we lose? The childless, the child loses his mother, his or her mother. In India, it's 103 per 1 lakh. In Sri Lanka, it's 36. And in Japan, it's just 5. In China, it's 29. South Korea, just 8. Thailand, 23. Taiwan, only 7. So maternal mortality is also, India is also very much far higher in terms of losing the mothers, losing the pregnant woman, losing the delivered mother, childbearing woman. Then the third column is about longevity, the life expectancy. Look at India's, it's 70.8 years. Sri Lanka, beyond 7 years, that means 77.3. Japan has 84.6. China is 77.5. South Korea 83.7. Thailand and Taiwan is also as 77.3 and 81.2 respectively. So you can see, particularly Dr. Shankar Khobragade said also about this, that Japanese people live beyond 100 years. They have a system called Ikigai. Ikigai means purpose of life. It's very much akin to Buddhism, purpose of life. The retired person or the person who also beyond 100 years of age, they are industrious. They are hardworking. They have a purpose of life. So let's come to the last slide again, that is conclusion. The aspect of preventing disease in Buddhism has deep roots in Indian traditional medicine that I already elaborated, because it's very much integrated with Indian medicine. And modern medicine has proved the effectiveness of cultivation of mindfulness. Mindfulness practice is very important if we want to avoid the diseases. And the integration of Buddhist philosophy into modern medicine has focused on patient-centric approach, because the person is not just a case for the doctor, is a mind-body combination, he's a person, he's a human. And that centric approach is, promulgated, it's developed by Buddhism. It's very much developed by Buddhism because of the practices like Metta Bhavana. The Buddhist countries had better integration of Buddhist practices because, for example, Ikigai, Kaizen has also been told by Dr. Tamanna. So that kind of integration, if we want to, achieve a culture of Buddhist culture of a culture into health, then we should have that kind of integration of Buddhist practices into the health system. Then further research is needed. Now there are many kind of research topics are there and research papers are there, but further research is needed in the Indian context to how this aspect of Buddhism, how Buddhist principles and practices affects health positively. So last one. So with this note that we have to save Buddhism if we want to save humanity. And Bodh Gaya Mahabodhi temple is very much important. It's our heritage. It's not only a national, but it's an international heritage. And Buddhism is an international religion. So we must save Buddhism and we must save humanity. So take care of your health, and again, wish you the very happy Vaishak Purnima. Thanks a lot. Thank you so much.